My name is Brandon Vieira. I am a professor of psychology at Full Sail University. And before that, I was trained and am trained as a licensed mental health counselor in the state of Florida. I've worked in settings including addiction settings working with homeless veterans, working with people who need to find work, helping them get employed, working with students at middle school, high school, and college level, and working in private practice and working with the Department of Children and Families with parents who've had their children removed due to substance abuse, trying to get them to a place where either their children can be returned or their children can be permanently placed. So that was an especially challenging one. That was for sure difficult. Oh, and I've had the opportunity to work with Orange County Public Schools on a diversion program from students who used to be expelled for getting caught using drugs on campus of schools, or sometimes getting into fights. And instead of them getting expelled directly, they're able to come to our program. And if they succeed there, they can continue on without being expelled. Vicarious trauma, especially, which is the fancy term for I heard something that made me feel traumatized, or secondhand experienced it, is very real and is probably the hidden top cause of burnout for counselors, as well as emergency medical technicians and people like that. And I think a lot of it comes down to can you be with someone, and can you hear something, and can you help someone without having to physically feel it yourself, if that makes sense. So there's two different types of empathy when it comes to like being with and present with people. And there's emotional empathy where you're feeling it with them, which is the kind of thing like if you ever watched an episode of a show like The Office, that you are there and you're feeling like, oh, this is awkward, and you feel it, right? Like that show draws out your emotional empathy, which is the whole reason that show works so well. But then there's also like intellectual empathy, which is the kind where you can say, yes, I know how this feels, and I'm going to understand you, and I'm going to understand where you're coming from, and that's more of a skill, and it's more of a built up, like I can see that you're feeling this way now and you were feeling this way at this point, and I'm going to be there with you so that you understand that I understand, but I'm not going to actually feel it with you, because then we're both in the mud together, so to speak. And there are times when the mud's too deep to jump in there with them, because you're not going to be helping them anymore. You're just going to both be dragged down. So that's something that's difficult to actually enact, but important if you're going to be helping people who are really struggling, especially with trauma, frequently. And then, of course, the other part of it is, who can you take as your own support? Can you keep a consistent prayer life? And do you have people who you trust that you can say, hey, I want to talk about how I'm doing right now, and I want to be real and honest that I'm not doing so well? Or maybe you have people that are bringing things to you and you're like, I don't feel good about this. Like this is too triggering for me, and I need to make sure that I help you how I can. And the best way I can help you is by making sure you find someone else to help you with this situation. So I think a mix of, I guess those are three different things. A mix of all three of those things is the survival method. But also there are some situations that, and some careers, like when I worked with the Department of Children and Families, like I did that for about a year, and I would not have wanted to do that for another year. I think it's just one of those things that even with the understanding of how to deal with all these things, some things are just short-term jobs, and that's how it is. There's learning intellectual empathy for yourself is like a roundabout way of saying, like, can you pull a memory from your past that is currently making you feel very strong negative emotions, and can you remember it? Can you understand that those emotions are happening and that you are still okay now? So learning intellectual empathy for other people and for yourself is difficult. And it's like, honestly, I think it is probably the most, or one of the most important things you learn in the whole like master's degree program for counseling, and in your first couple of years with a supervisor before you're licensed and all, because it is really difficult. And a lot of people struggle to learn it. And some people are not cut out for those kind of helping professions in those situations long term. And it doesn't mean that, there's something wrong with that person or they can't be a helper. It just means they would be better limiting their exposure to those things, because the less you can shut yourself off from the emotional weight of the very heaviest situations, the more you're going to feel that weight, and the more you're going to be weighed down and have that vicarious trauma, which is real. I mean, people can suffer from everything from acute short-term trauma, trauma responses from, hearing about other people's concerns, especially on a continuous basis, to, full on like post-traumatic stress, and really have real serious concerns because they're hearing that and they're feeling it. And in many cases, they're taking it on, or it's reminding them of their own past. And it can be really, really difficult to deal with.